Hi everyone, welcome to your instructional video for Vignette 1 that is due on week 7. When you go into your assignments, as I just did, you'll click on the link to Vignette 1 and it will give you the instructions for how to proceed in completing your Vignette Part 1. The vignette is basically a client discussion where you're giving the background information. It's very similar to a biopsychosocial. However, this type of assignment is different from a biopsychosocial because you are outlining more of the psychological history of the client and focusing more on any of the behavioral manifestations, the psychological challenges and difficulties that the person may have, the dysfunctional elements of certain behaviors or histories of certain behaviors that are going to eventually lead you to a place of being able to do a diagnosis. And this is very different from a biopsychosocial from the standpoint that, oftentimes in the biopsychosocial we look from the strengths-based perspective, even when we're discussing the problems and the challenges. When we're doing a traditional psychological diagnosis, we're looking really at, as we will talk about and have talked about, it's really based on a medical model, and oftentimes the medical model is a deficit-based model. So you're going to be looking at certain elements of the biopsychosocial, right? If you look down here, you're going to do the presenting problem. You're going to identify where you get the sources of information, do a brief overview of the client with their identifying demographic information. What is the presenting problem? For example, are they hearing voices? Are they struggling with depression? Are they having challenges with their attention? Are they having relationship issues due to aggressiveness or trauma, etc.? And you're going to talk about this problem from the person's chief complaint. Now, this is again different from the biopsychosocial because you're really not going to be talking about one of your clients, say, who is homeless. The only presenting problem, while that might be the chief complaint, is that they're homeless. For the purpose of this vignette, we want to look at what are the behaviors that might be diagnosable that are leading to his homelessness. So, for example, if you are working with someone who is homeless and the person's chief complaint is that they don't have a consistent place to live and they're homeless, you want to put in a caveat that part of that may be because they hear voices and have a potential diagnosis of schizophrenia. So you always want to be thinking about, from the clinical vignettes, for the purpose of this particular class, how their chief complaints, such as things like homelessness or relationship issues or difficulty maintaining employment, while they might be the reasons they are looking for social work services, what are the underlying behavior manifestations that are creating those chief problems and complaints. And so you're going to look at the history of that. If the person's been hearing voices, if they have a history of depression, what is that history? Looking at the psychological history in terms of school, any trauma, any major events in their personal or family life that lead to the particular challenges that they're struggling with. And thinking about if, for example, the person is struggling with something like schizophrenia, bipolar, or depression, you want to also include in this psychosocial history discussion if the family has a history of psychological diagnoses. If a person that you're working with has a current diagnosis from a physician, then you want to indicate what that diagnosis is and any medications that they're taking. You want to indicate the diagnostic assessment. And so you're going to do the best that you can to do the diagnostic assessment based on the diagnoses that we've covered so far. So, for example, the hope is that by week 7 we will have covered substance, addictive, trauma, stress-related anxiety disorders, etc. We definitely will also have covered child-related disorders, so you may be able to do child-related disorders as well. So you want to use the diagnoses that you're most comfortable with because of what we've covered in class, and you will do a very brief diagnostic assessment of them. Follow the rubric. The rubric is located in the syllabus. So the rubric is what I'm going to be using to grade your paper, so it's important to be sure that you include all of the information. It's the same information that's in the description of the assignment, but you want to be sure that when you do your introduction that you include and explain your role with the client. You want to indicate where you got the information from, whether it's interview with the client, whether it's documents. You're allowed to use other psychological profiles or other assessments that have been done in the client's past if you have access to them. You want to be sure to prohibit or protect the anonymity of the client, so never ever use a client's name when you putting the identifying information in, but use an alias. You can do Mr. B, Mr. Brown, Miss Smith, etc., Jane Doe, however you choose to title them, and then indicate the other information like their socioeconomic status, gender, race, sexual orientation, etc. You want to identify the presenting problem as it is presented to you either by other agencies or your own assessment, in addition to the way the client identifies it in their own words. You want to do the history of the problem, the psychosocial history of the individual, if they have a family history of any kind of psychological issues. You also want to include the person's childhood, any childhood traumas, any childhood grief, loss, cultural issues that may impact the manifestation of the challenges. Talk briefly about the person's strengths and the resources that they have. Look at what now you're going to move into the assessment piece where you're going to do your own assessment of the problem. You're going to look at any diagnosis that the individual has and then do your own identification of a diagnostic assessment based on some of the diagnoses that we've already covered, such as either the substance use, trauma, childhood, anxiety, etc. And looking at how do the behaviors manifest themselves, what are the signs and symptoms that correlate with the DSM-5 signs and symptoms. Make a list of the different behaviors and a list of the risk factors that might lead to those particular symptoms, and then identify the potential diagnosis that you believe, right? So the provisional diagnosis. So based on this diagnostic assessment, the different behavioral manifestations that you have found, you're also then going to talk about why you believe they have a particular diagnosis based on those particular criteria. Identify the criteria for each of these provisional diagnoses. So for example, if you believe they have depression or substance use disorders or anxiety disorders and you're trying to rule out those 3 different disorders, you want to put the criteria for each of those provisional disorders and then identify in that differential discussion which of those provisional diagnoses you have decided, which ones you have ruled out and the reasons that you've ruled them out. And then come up with what is your final then diagnosis. And that can all be part of one paragraph, or you can divide it up by these different headings. But if you go back to our diagnostic and assessment PowerPoint and look at how we talk about working through a differential diagnosis, creating several potential diagnoses, which are the provisional diagnosis, and then doing the rule outs for the diagnoses based on whether they do or don't meet the number of criteria. As always, use your APA style and formatting, and if you have any questions, please be sure to email me. That's the most effective way of communicating. Good luck.